Hi everyone, this is Naheen. Today in this presentation, I will pitch you guys the top two companies that I have picked for in-house healthcare partners. But before that, I would like to give you guys an overview. So this is the agenda, the slide. I have the agenda. I'll cover the RCM market overview and challenges. Firstly, secondly, then I'll talk about the industry drivers and trends in the RC market that I'm seeing and in the broader healthcare industry as well. Then thirdly, I'll mention the top two picks of deals that I've chosen, and then we'll conclude. So let's get right into it. RCM market overview. So as of 2023, the revenue cycle management market is valued at 49.6 billion, as you can see. 2028, it's projected to increase by 84 to 84.1 billion, which you can see it's almost double. Why is it increasing? You can see the CAGR is 11.1%, which clearly shows growth rate. So why is the RCM market value increasing? Well, it might be because the increased demand of healthcare will continue to rise over the years. It can also be because of the whole value of the market overall. For instance, we know that healthcare industry deals have complex network of insurance providers, government payers, self-pay patients. So RCM services help navigate the landscape by ensuring accurate coding, claim submission, reimbursement management. We will talk about this later, but all of these really add on to the value. And that's why you can see the market value is projected to increase. What are the challenges? Well, everything comes with challenges, and so does the RCM. It will face challenges. So we'll face regulatory complexity, payer complexity, manual processes. These are some of the challenges. So regulatory complexity might be the frequent changes in healthcare regulations and billing codes, which requires continuous training and adaptation. The continuous changing of the codes and other regulations. Payer complexity might be dealing with multiple insurance companies with different reimbursement policies and requirements and keeping up with all of these. Manual processes might be manual claims denials, delays, coding, payments, all these manual processes. Those are also challenges. Now let's talk about industry drivers. What needs to be changed? We need a greater price transparency. And what do we mean by price transparency? So patients should know what they're paying for. Healthcare costs should not be hidden or charged in a way that patients don't know what they're paying out of pocket or through the insurer. They should know what they're paying for, and that is price transparency. Reduced healthcare costs. So we all know that the United States has one of the most expensive healthcare system, and having a greater transparency would enable patients to know what they're paying for, and in that process reduce any unusual cost that they didn't incur but still were charged. So that would again help reduce health costs, because we often get charged by costs, healthcare costs that we didn't do or was just a mistake. It's just there. We need environmental measures. So environmental measures like EHR can be used instead of paper for record keeping, which can again promote sustainability because we are not wasting paper. Then proper cash flow management. Effective cash flow system will help prevent cash shortages and reduce the need for borrowing, and again ensure financial stability. So proper cash flow management might mean keeping track of the patient's payments, making sure it's the outflows, inflows are all correct, making sure that everything with cash flow is coming in properly and they're not charging overly or underly, like it's keeping a track of. Let's move on to talk about the trends. So in this data-driven world where technology, AI, machine learning, there's so many different things, relying on data is what is driving these changes. Even in healthcare, they're all RCM. Everything is being relied on data to drive and make changes. Data is used to make changes, and data is fed in. For instance, even AI needs to be fed with data to work on a chat. If we talk, the second trend is outsourcing, which is, again, many healthcare organizations are choosing to outsource some or all of their RCM processes to specialized companies that have expertise in handling billing and revenue management. So again, we see a lot of these outsourcing trends in healthcare tech. Then again, transitioning to virtual care. This is also a trend. So what do I mean by virtual care? It would be like having, let's say there's a doctor's appointment. It would be, instead of physically going to the hospital for the appointment, the patients could just have a Zoom call or a virtual call with the doctor for checkups, for follow-ups. It's just easier, saves time, and time is money. So we gotta save that. Now let's move on to the first deal I have for Enhanced Healthcare Partner. So this is Turquoise Health, a private company that I've chosen. It's a private healthcare IT company whose vision is not so distant future, where prices have menu-like clarity at a fair market rate. So that's its vision. Its mission is guiding providers and payers to simpler agreements, resulting in clearer prices. So you can see, and also if you look on the left side, you can see the pricing API. These are the services that Turquoise Health offers: pricing API, batch pricing engine. So all these things, you can just jump to one conclusion, that it enhances, and it really wants to establish price transparency. Price transparency is the core of RCM processes. It allows patients to make informed decisions about the healthcare, which I've stated again beforehand. When patients understand the costs associated with different treatment options, they can choose the most appropriate and cost-effective course of action. Being transparent about costs builds also trust between patients and healthcare organizations, which again aligns with the regulatory expectations for price transparency in healthcare sector. So again, price transparency is one of the major essential things of RCM, and it also helps the patients, the vulnerable population that has no clue what they're paying for the services. Let's say for an X-ray, they have no idea, or for an MRI, they have no idea how much they would be charged. In having price transparency would actually allow them to know how much an MRI cost and why they were charged that amount. It's not a very weird amount, but they would know why they were charged for something and then pay for it knowingly. So it would help the vulnerable population and improve patient outcomes. So this is why this company would really fit into Enhanced Healthcare Partners portfolio, because again, it's caring about environment, about the population, while keeping into account the RCM our revenue cycle management core of that price transparency in mind. Other than that, it also satisfies other major requirement that Enhanced Healthcare Partner really wanted. For instance, they wanted like a privately owned company which does not have any institutional investors, or in sort of I don't know, private equity, venture capital investors. This is a private company, then this has revenue going on, this is US based. So this is what this company I chose. Let's move on to the next company that I have for you guys, which is InstaMed, a healthcare payment simplified system. So InstaMed products deliver healthcare payment solution on single integrated platform. A platform connects providers, payers, and patients. An integrated payment solution can seamlessly integrate with existing RCM software, creating a unified ecosystem for managing financial aspects of patient care. By integrating payment solutions into broader RCM strategy, healthcare organizations can improve their financial performance, enhance patient satisfaction, and streamline administrative processes. The combination of accurate billing, efficient payment processing, and transparent financial communication contributes to a more effective and patient-centric RCM process. You can see on the left side, I have stated all the services to offer, which again, the core of their service is the payment service, which again, as I've mentioned right now, relates corely to revenue cycle management. Again, optimizes patient by providing an integrated service. It's connecting patients, providers, and payers together and optimizing efficiency, which is also something that enhanced healthcare partners is looking for. Other than RCM, core of RCM services, processes, and then efficiency. They also, just like the previous company that I've stated, this also satisfies the requirements that enhanced healthcare partners had for its portfolio companies. For instance, it's privately owned. Instamet does not have institutional investors. Its revenue is above $10 million. It's US based. So again, all these requirements, this deal really goes through. With that, I've mentioned 2 deals and I would like to end this presentation. Hope you guys enjoyed it and hope that my deals would be taken into account. Thank you so much for your time.